you're gonna listen for the breathing. So you're just gonna say, you're gonna instruct your person when to take a deep breath. So take a deep breath. Good, and out. Again. Again. And you're just gonna go side to side, compare, and tell them to take a deep breath each time. And then you're going to say how the lungs sound. So hopefully nobody should have adventitious lung sounds that day. So for most people, you're just going to say that the lungs sound clear, unless you hear something, and then you would say what you hear. Let's see. Oh, and then directions for the breathing technique. So you're just going to instruct them when to breathe in and out. Okay, and then your next part is the anterior chest. So you'll move around to face your patient, so you're just going to look for the skin characteristics, which you're doing on every part, by the way, throughout the exam. But right here it just says that. So I guess you would want to see it again. You know, I've been looking at the skin characteristics throughout. And you just want to basically, you don't need to do tactile fremitus on the front, but you just want to kind of palpate the anterior chest. Just see, note if you feel anything. And then you're going to listen to the breath sound. And then you remember they're a little bit high, you're going to hear them a little bit higher up in the front. So take a deep breath. And you're going to do the same thing. Take a deep breath. And then down. And then remember in the front you want to go off to the side a little bit too. And then for, this is the part where it matters if your partner is male or female. If you have a female patient, you want to instruct them as far as the breast self-exam. Okay, so has everyone learned that?
That's a sheet.
Yeah. So what you just want to remember is that that you're going to do like 3 depths at each point, and that there's a pattern. So, and there's 2 options really for the pattern. You can go up and down, starting from the very outside by the armpit, and just go across, or you can go in a circle, starting at the middle with the nipple, and then going outwards. And you want to make, instruct them to make sure they get all of the breast tissue too. So those are the 2 kind of key things you want to tell the patient for the breast self-exam. Okay, and then while you're on the anterior chest, you're going to do heart and vascular as well. So you're going to inspect, so you're going to just state, I'm inspecting the precordium, say what you're looking for, which would be pulsations and heaves, which you may see a pulsation, that may be normal. You're going to palpate the apical impulse and note the location. So you're actually going to demonstrate that you know where the apical impulse is. So you're just going to go where you think it is, right? And then feel around until you can actually feel it. And then you're going to say, it's right here.
Does the position change?
The position?
Yeah. This whole time, everything that's been done, your patient has just been sitting.
Yeah, you can. Most of this is
Changes of the abdomen.
until you get to the abdomen. Okay. You're gonna palpate, and you're gonna notice if you feel any thrills. So any like vibrations anywhere on the precordium. I'm just gonna notice that. And then you're going to auscultate the heart sounds and make sure you use both the diaphragm and the bell of the stethoscope. Okay. And you're going to go in the order of not the Z shape, but the aortic, pulmonic, Erb's point, tricuspid, and mitral areas. So you're going to go in that order. So you're going to start, remember that one, you start over here. Okay, and then you have that. And then your mitral, remember, is a little bit over. So you want to remember to go in that order, and you want to use, and you're going to use both the diaphragm, and then you're going to repeat it and use the bell of the stethoscope. Okay, now for the abdomen, you're going to ask the person to lie down. Okay, and if anyone chooses the gown option, you're going to want to put the blankets over your patient because you're going to have to lift up their gown. So you'll put the blankets over. If you just choose the comfortable clothes option, it doesn't matter because you'll probably be wearing pants. Okay, and you want to start with it. You want to start with it flat. So you're going to inspect, and you're just going to say what you're inspecting for. So of course, the whole time we're saying skin, right? So you're looking at the skin, you're looking for the contour of the abdomen, which should be what? What do you see for the contour?
Flat.
Yeah, flat. It can be rounded. Rounded or flat is what you'll see for most people. And then remember, because this is the abdomen, we're going in a little bit different order, so we're auscultating. So you're just going to listen to all 4 quadrants. Okay? And as you're doing that, you'll say, you know, I hear bowel sounds. They seem to be normal. Unless there's something that you hear that is abnormal, which most likely you will not. After you auscultate, the next step is to percuss. So you're just going to percuss each quadrant, and you're going to state what it should sound like. So you're listening. You should hear tympany. It should be tympanic. When you percuss, it should not be dull on the abdomen. The next step is palpation, and you're not going to do the deep palpation for this. You're just going to do the light palpation. So you're just going to go down about 1 centimeter. And you're just going to say you're noting any irregularities or any involuntary guarding when you do palpation. And then you're going to, while you're on the abdomen, you're going to palpate the femoral pulse. So you're doing the pulses kind of just by body area, by where you are. So you're just going to palpate for the femoral pulse as long as you're there. And you're going to know, where it is, that it's normal, that it's 2+ or whatever you think it is. Okay, once you're done with the abdomen, cover up, and you're going to expose the person's legs. Okay? And this is this is where if you have a male patient, you want to give instructions on the testicular self-exam, which is also has everyone read that? Yeah. Okay, so you just want to make sure that you give those instructions at this point. While just remember, you're kind of in the groin with the femoral pulse right now, so that's when logically it's a head to toe, that's when you want to give the instructions.
Are we explaining those, like, even if we have a female, do you want us to say, okay, if this is a male, this is how we explain it, or no?
No, it differs according to your patient.
Okay, because it's like
Yeah.
2 points for the breast and then 2 points for the testicular. Does it count against you if you don't get the
No, I
2
think
points?
it's 2 points.
I think that's
Yeah, that's for
Each
the
one
for that's for that section. Yeah, so it just depends what patient you have, what instructions you want to give. Okay, so you're gonna look. So you're gonna look at the legs. You're gonna state what you're looking for, and this is where you want to really say you're looking also for hair distribution, because that makes a difference sometimes in the legs. Symmetry, skin characteristics, and hair distribution. And you're gonna palpate 2 pulses on the legs. You don't have to do the popliteal pulse. So you're gonna do the posterior tibial, which you guys remember is over here, right? And then the pedal pulse. Okay. You're gonna check range of motion and muscle strength of just all the joints in the legs. So I'm gonna ask you to flex your hip and bend your knee. Good, and the other side. Good, so then you got 2 right there. You'll notice that they're equal. And then you're gonna also ask them the ankles and feet. So can you point your toes? Good, flex your feet. Good, okay. And yeah, go around in circles. So that's just, you're gonna check, that's just like kind of a basic check. You see that it looks normal, it looks symmetrical, and that they're able to do everything. And that's kind of a basic check for the strength and the range of motion. Then you're gonna have them sit up again. Okay, and you're gonna still have the legs exposed, ideally. Okay, and then you're just gonna check the deep tendon reflexes on each side. And make, say whether they have a normal reaction with that.
And if you don't get it, remember,
Yeah, and that's you only just do this deep tendon reflex. You don't have to do all of them.
Oh, just the lower shoulder.
Yeah, you just do the patellar.
Just the patella.
Okay, now, and then for neuro, then this is going to be kind of your last part. You're going to have the person stand up, and you're going to ask them to walk. You're going to observe their gait. And then just say that you're looking for the gait to be steady, that you're looking for it to be smooth, and they don't have any involuntary movements. And then you're going to do the Romberg sign. So you're going to ask them to close their eyes. Good. And they hopefully shouldn't fall down. Okay, and what they mean by stabilized pelvis and test range of motion of the spine is you're going to stand either in front or behind the person and just kind of, stabilize like this and ask them, can you bend side to side? Good. Backwards. Good. And can you touch your toes? Good. Okay. And that's just, basically the range of motion of the